see.
Hi, Jackie.
Hello?
Hello. Can you hear me?
Hello.
Yes.
Yes.
I'm going to try to
I'm going to try to speak.
Okay, you start. I'm going to not speak.
I'm going to not speak because of feedback.
Okay.
Right, okay. Is
Okay.
it that bad? Yeah, okay. All right. Well, I'll do my best. I'll have to keep taking a swig of water though because I'm still suffering from my chest infection to an extent, so I'll try not to cough. I hope everybody can hear me clearly. I'll start with my story. Okay, a little bit about me. I'm 50 years old now.
Charles, we can't see you, by the way.
You can't see me. Well, that'll be useful. Let me see if there's a hold on. Can you see me now?
Yes.
Yeah. Can you see me?
Okay, hang on. You speak.
You speak.
Okay.
When I need to talk to you, I will phone you.
Okay, no problem.
Okay, bye.
Bye. Well, hopefully you can all see me and hear me, so I'll just get started. I'm sorry about the feedback, and I'm just getting over a chest infection, so I might have a swig of water occasionally, just in case I start to cough. But a little bit about me, first of all. I don't know the...
What have I done?
It goes back to when I was... Can you hear me? Yeah. Goes back to when I was about 4 years old, when I first realised that there was something a little bit different about me. At 4, I started to suffer from OCD. I was at a convent school, don't know why. I was 4 years old, and my parents had given me a little Tupperware box with my thermos flask and sandwiches in. And I dropped my thermos flask on the parquet floor. Immediately heard that familiar noise of broken glass in the old style thermos flasks, and when I opened it I saw my tomato soup with glass in it, and from that moment on I sieved food through my teeth, and I didn't stop doing that till I was about 26. It was at that point, I guess, that I was old enough to realise that what I was doing was inappropriate and different to what other children perhaps did. And it was at that moment that I kind of activated my high-level fear disorder, and I prefer to call it a fear disorder, because it is, after all, a disorder of the emotion of fear and not a disorder of anxiety. Because my definition of anxiety is that it is the disorder of the emotion of fear. I believe that anxiety is a disorder. Through my early childhood, I suffered from the typical manifestations of school phobia. I started to develop panic attacks. My eating disorder, as a result of my OCD, meant that I would limit what I ate. I would choose very carefully what I ate in case it contained any contaminants or anything that could choke me, for example. This, as I got towards 10 years of age, I started experiencing school phobia, so I was complaining to Mum that I really didn't want to attend school and that I really wasn't coping with it. She started to become worried about my mental health and took me to the local GP. He diagnosed anxiety, didn't really get much more of a diagnosis, and gave me some old school antidepressants, which I guess at the time may have had some kind of soporific effect. I don't, I don't remember the feelings I had, but I remember the thoughts associated with the feelings. So I remember feeling very monophobic, didn't want to be on my own ever, very school phobic, very agoraphobic. As I got older and I started competing in sports at school, things really took a turn for the worst. My agoraphobia took over. I really didn't want to travel at all. Going to school was bad enough without going on school trips or going on skiing holidays with the school, for example. And I was fortunate that I had these things to do, but I didn't want to do any of them. So as I went through my teens, I guess, other things come into play. I mean, obviously I had my first girlfriend and I started socialising more, and despite the internal turmoil, the emotional turmoil I was in, I was a big, strong lad. I rowed for the local rowing team. I played rugby quite well. I played for the local team. I played for the district. I played for the county a couple of times. I wasn't a shrinking violet. I wasn't somebody that a person would describe as in any way vulnerable or weak. But it was all masking this underlying and self-perpetuating fear, mostly of being alone, mostly of being ill, mostly of being contaminated by something. And of course, as I went into my teens, I started to realise that although mental health issues weren't as talked about then, and certainly I wasn't given any information with regard to my OCD, I developed HOCD, which is where somebody who is heterosexual might be led to believe that they're gay, so they start questioning their sexuality, and it can happen in both directions. That was quite disturbing to me, especially when I had a girlfriend, of course. And all of these thoughts, they were never described, they were never explained to me by anybody. I asked psychologists, I asked my GP. My mum was a nurse practitioner, so I had a lot of access to medical people. At that point in time, I wanted to be a surgeon, so I was volunteering in the local hospital and watching surgery take place on a box, and that didn't faze me at all. The only time I got fazed by that was when I had to make a career decision, and I realised that if I wanted to be a surgeon, and I also had panic attacks and anxiety, having a scalpel and the responsibility of operating on people in that kind of emotional state just wasn't at all the sensible thing to do. So I veered away from a medical profession, and I went into art, which I'm relatively good at, and decided to go to art college. But through all of this, I suffered with fluctuating levels of anxiety. And it did fluctuate with what I was doing in my life. Of course, the more distracted I was, the less evident my anxiety became. The strange part of my story, when I was 18, I decided, for various reasons that I won't go into, mostly to do with family, that I wanted to go and live in Germany. So I went out on my own to Germany when I was 18, nearly 19, and I stayed there for nearly 6 years, till I was 24. During that time, again, my anxiety fluctuated at various levels, and I became incredibly, my panic disorder took over. I became incredibly agoraphobic. My journeys were only to get from home to my office, and really that was only because I had a car and I felt safe in my car. I had to travel a lot around Europe, and I did that despite the overwhelming agoraphobia. I don't know how I did it now looking back, but I did. But as I stayed in Germany, the longer I stayed there, because I think in my adulthood I was more aware of the frailties of life, and because when I was, I think I was 23 when it happened, I had a phone call to say that my father was in intensive care and had a double heart bypass, which was my worst nightmare. Through my teens, my health anxiety took over, and my obsessive compulsive thoughts and rituals took over. And I was living with a woman that was working in medical health care. She was county coordinator for HIV and AIDS for Worcestershire. So of course there were contamination issues there, so that escalated my anxiety. And then of course when I was in Germany, my dad had his heart issue, my granddad died, and all of this just brought me closer in adulthood to the frailties of being a human and being an adult human. And of course that all exacerbated my fear, appropriate fear, but in turn it then knocked my anxiety higher and higher until I literally hit the deck one morning. I was at a fuel station in Heidelberg filling my car with petrol, and I felt something cold on my shoulder, and as I looked up it was the floor, and it was literally like that, and somebody was lifting me off the floor into an ambulance. I was rushed to hospital, and they said I had a huge panic attack. And it was at that point that I decided to return to England, which I did in 1992. It was when I returned to England, I returned to a home that was different to the one I left. My brother and my parents had forged a relationship that excluded me, and I think I felt so lonely. I went to live in Hull, got a place at university, and it was in Hull that everything just went horrifically wrong. My disorders, and it was multiple disorders at that point, my agoraphobia, my OCD, I had a metaphobia, so I was scared of vomiting, scared of illness, every illness. My health anxiety, I had derealisation and depersonalisation. I developed an eating disorder which started with me stupidly taking laxatives because I felt I was gaining weight because of the medication I was taking for the anxiety and the depression that they told me I had. And the whole thing escalated. I was a physical wreck. I was 18.5 stone. I hardly left the house. my panic attacks, I had 8 to 10 panic attacks a day. All of my phobic responses and obsessions were off the scale, about anything and everything, and in quick succession, day and night. I wasn't sleeping. It was absolutely horrendous. So I returned from Hull to Worcestershire in '96, and I got a work placement because, as my mum said, you're so anxious, you might as well be anxious and out as anxious and in, because wherever you are, you're as anxious, and it makes no difference. And I kind of agreed with her. So I decided to get a work placement at a TV studio, which was horrific to start with. But after about, I was going in and out of day hospital. I was heavily medicated. I was taking diazepam as if it was sweets. I was literally told by the doctors to take them as I needed them. So I did, and I went from 2 milligrams to 6 to 8 to 10, until I was taking about 40 milligrams a day. And that was literally self-prescribed. And I just phoned the doctor and said I'd run out each week. They put me on Prozac. They put me on a drug called Zispin, which made my head buzz. They put me on a drug called stelazine, which is an antipsychotic. Nothing worked. I was having 2 sessions of psychology a week. So that was CBT based. I was seeing a counsellor privately, separately, that my mum knew. I had a community psychiatric nurse. I was going to a day hospital to literally make things out of paper loo rolls and that sort of stuff. Which of course, these environments and these situations, all they do is further exacerbate your belief that there's something wrong with you. So in 1996, I decided that enough was enough. I'll tell you a very quick, strange story. I went to a volunteer centre for a day, and I met a girl who was born with cerebral palsy, and she was very difficult to understand. She was a sweetheart, but she was quite aggressive in her tone, and she scared the life out of me. And for that day that I was at that volunteer centre, I came to the conclusion that my anxiety levels, my fear levels, were literally directly related to my intellectual engagement. So when I was distracted, my anxiety went down. And I started to think, hold on a minute, if this is the guy that the psychiatrist, because I'd seen my psychiatric reports and my reports from my GP, because my GP had become a good friend of mine, because over the 3 or 4 years that she treated me, I saw her more than I saw anybody else. And she had a great sympathy for my situation, because she herself had suffered at medical school. So I knew what my notes said, and I thought to myself, if I'm this guy that is chronically mentally ill, that needs psychiatric care, day hospitals and medication to be normal, and I've been told by multiple practitioners at that point that my life would never be normal, that I could never ever lead an anxiety-free life, I thought, why is it then, when I'm with this person and we're doing these things, why does my fear level drop? If I'm physically ill, if my illness is actually physical, albeit mental, but obviously that manifests in the brain, which is a physical organ of the body, and it's produced by chemicals and electrical signals and everything else. I thought, well, how come I can feel very well all of a sudden? So I went away and thought about it. Anyway, cut a long story short, over the next 2 days, I created a day structure program and a day practice ethos, a life practice ethos, if you like, that would work for me, that would mean that I wouldn't be consumed by the thoughts and the sensations, that they would take second place in my brain, take second place in my consciousness, and that I would somehow live despite those. And in a day, I felt dramatically better. In fact, the next day, I didn't have a panic attack at all. I was back at that volunteer centre, but I was feeling not normal, but I was getting glimpses of normality. By day 2, things had changed profoundly, and I added some ingredients, if you like. On day 3, I went back to the day hospital, which was my weekly or bi-weekly session at the day hospital. And as I walked in, my CPN said, "There's something changed." And I said, "Yeah." I said, "My anxiety's dropped." "Well, what did you do?" So I gave everybody a sheet of paper, literally a sheet of A4 paper, and on it were scribblings like this. I said, "I'll tell you what, all you anxious guys that are with me, take this away, have a look at it, and see what happens." Anyway, the next day, I was getting messages on my phone saying, "Hi, Charles, this is," whoever it was, "if you were doing this today, how would you manage it? What would you do? What techniques would you use?" So I text them back. Anyway, I'll cut to the chase. 6 months later, I was supporting about 150 people. 12 months later, it was about 1,200 people. And it was at that point that I had to make a decision whether my life was going to go, because I was working back in television again and feeling completely anxiety-free in days. In fact, in less than a week, my panic attack stopped. All of my puro thoughts, my obsessions, and the compulsions related to that, my health anxiety, my issues with eating, all started to settle down. I could see that I was starting to lose weight, and I just felt enlightened and almost reborn. My doctors couldn't believe it, the psychologists couldn't believe it. But it was all through this day structure, plus the compliance rules, plus the deep understanding, and the reassurance I'd given myself through the knowledge that I collected. So 12 months later, I made a career move, and I said, you know, if this is my thing, then I have to give up the television work and work solely to help these people, because you know, the suffering that I've been through from 4 years of age till I was 26, I would have done anything to avoid anybody having to go through that. So I structured the program as time progressed. I took on a couple of psychologists and taught them what I was doing to help me to field all of the calls and the emails I was having, and it escalated like that. And now that was in '96 it started, so '97 was when the real escalation happened. And to date, we've helped, I think we've just gone past 263,000 people. Just to give you a little sort of insight into who we are, because I think a lot of people look online at our stuff, and because it's written in such a familiar tone and from the heart, I think people presume it's just me sat there in my underpants in the back room creating websites and product to sell to people, and that's not the case at all. You know, from that, we've always maintained that it's much more productive for sufferers to see the real us and hear the real us, and for us not to be rehearsed and practiced. And so we've maintained that over the last 22 years, because we believe it's the most effective way of reaching people, and having that level of interaction with people that means they're going to listen to you and actually take action on what you say. We're now an NCFB accredited educational facility. We've got about 26 staff, some of them are full-time, some of them are part-time. Our support team are BACP and BPS psychologists and psychotherapists who are also trained in what we call LAR practitioner accreditation, which means that they've done an NCFB level 4 professional level course as an anxiety recovery practitioner, which is a course that we created. They're all ex-sufferers, the support team. In fact, most of my staff are ex-sufferers, but they're all, as I say, trained in their areas of expertise. We run online programs. We have residential retreats, which are 4-day retreats. We have workshops. We do corporate training. We do corporate training videos for emotional health awareness. I'm not a psychologist. I'm not a psychiatrist. I'm not medically trained. And when people talk to me about why I'm the head of this organisation, it's very simple. You know, 22 years of suffering prepares you for a deep understanding of these conditions, and another 20 odd years of thousands of cases where, without exception, when somebody does what it takes to recover, they do recover, tells us that we're doing something right, and that I then employ professional people to administer the program, people who have the ability to communicate the core messages and the core science and the reassurance, structure, support and guidance that is needed to make recovery happen in every case, regardless of age, regardless of time suffered, regardless of the severity of symptoms.